Based on these findings, which of the following is the most likely underlying embryologic event that led to this condition? Defective closure of the anterior neuropore, defective closure of the posterior neuropore, failure of the lateral mesoderm migration, failure of the neural crest migration, or failure of somite formation. A 2-day-old infant is found to have a sac-like protrusion on the lower back containing meninges and spinal cord tissue. The infant also has club feet and hydrocephalus. Based on these findings, which of the following is the most likely underlying embryological event that led to this condition? So when you have an infant who has a protrusion in the back and it has the meninges, it's called a myelomeningocele. And I'm pretty sure it's through a neural crest cell migration failure. I don't know 100%, but I'm gonna go with that, and that's all I can think of. And I have no reason to change it, so I'm gonna go with that.
There you have neurocrest. Final answer.
Yes. Oh,
Yeah,
man.
no, it's okay. To be honest, on a test taking strategy standpoint, right? Embryo is tough, right? But anytime, to be honest, this is what I tell most of my students. Anytime you see neurocrest and you're not sure what the embryology is, then go ahead and pick neurocrest because most likely it's the answer. Because they like testing neurocrest because there's a lot of exceptions with neurocrest cells. But in particular, when you're dealing with you have the diagnosis, which I love, right? But all these kind of meningomyelocele, things like that in embryo, they're all going to deal with the neuropore. Okay.
Neuropore. So what's the
Yep.
difference between the anterior and the posterior?
Anterior is going to be the very top, so you kind of where your head is. And so if you don't have an anterior neuropore closure, you're going to have like ancephaly, right? Meaning like no brain, right? Or so, right? So that's going to be super severe. But posterior neuropore is going to be kind of like your spine area and all the way down. So
Okay, that makes sense.
okay, but it's going to be your neuropore. So which it's easy to kind of make sense because neuropore as in kind of your CNS, right? The neural part of your development.
Yeah, in the posterior, it's going to be towards the caudal end of your body.
Exactly.